Community Bank of Dublin Lawrence County is here to help with all of your financial needs. Our team knows what it takes to make life easy and convenient and will help you get set up with our mobile and online banking. We founded Community Bank on common sense banking and a dedication to help people just like you. Our loan officer Gail Rainey and branch manager Amy Thompson know what it takes to make life easy and convenient and can help you with loans with almost everything, from your automobile, home, land, or any financial goals you have. Come visit us today. Community Bank of Dublin Lawrence County, where common sense banking never goes out of style.
It has been a challenging 18, 19 months, obviously. I think for this whole community, we actually had a prayer vigil at the hospital last night by the pond that was very moving and meaningful that the community participated in. Where are we now? Full. We continue to be very busy. Right now, as we speak, there's 23 people in the ER. About half of those are COVID patients. In case you wonder, we have a 22-bed ER. We've had as many as 60 patients in the past 2 months at one time in our ER. Hallways are full. We're seeing people in the waiting room. We've had as many as 28 patients in the ER amongst over 40 patients in the ER, but 28 waiting to be admitted, waiting for a bed. Our length of stay is longer, which means we're not discharging as many people. It's been over a year since we've had an ICU bed open for longer than an hour. So there's always a patient that fills that. And to get an impact of that, our normal census, we have a 16-bed ICU. We've actually expanded that to 24 beds over the past 6 or 8 weeks. Just to handle the number of people on vents, we've had as many as 22 patients on a vent. And so our hospital census, which has not been at 100% in my nearly 14 years in Dublin, has been at 100% most of the last month. And on occasions over 100%. Now, how do you get to over 100%? Well, we've opened up some extra rooms. We've also, somebody gets discharged, we clean the room, put them back in. So statistically, 2 people were in that room in that same day in terms of discharge. Now, don't worry, we're not double charging and stuff. It all goes by midnight census. But basically, that's the kind of busyness we've had. We haven't done elective surgeries now for 3 weeks, and we're not likely to do them next week. We're hoping we can maybe do them the week after and get back on a little bit of a normal schedule. What I have seen, particularly in the last month, is a level of resilience that I've never experienced before in my career in the Air Force or as a civilian hospital administrator. I've seen people, live out Scripture in ways that, whether they're intending to or not, but I see, people helping each other and supporting each other. And one of my favorite passages is out of Thessalonians, that therefore encourage one another and build one another up. And I see people encouraging each other and supporting each other and praying together and crying together and hugging each other and even laughing together. And that it's almost like this, big group hug every day as they get through this. A nurse told me recently, about a week and a half ago, I was out there one night, and a nurse was talking. She had come in to do an extra shift, and the reason she came in was because she said, I knew if I came in to work an extra shift, we'd be staffed appropriately, and the other people wouldn't have to take on extra patients. And that's what I'm seeing is selfless service, but it's also hard on them. On Wednesday of this week, after I got most of my work done, I went up and made rounds late into the evening just to be around our ICU nurses, our nurses on the units that are seeing COVID patients, the ER, because that day, on Wednesday, we had 5 COVID deaths. We had a COVID patient come into the ER, and she was doing so badly they did an emergency C-section to save her baby, who's doing well. The mother is still struggling. And that's what we're facing kind of on a daily basis. I see just incredible examples of people that are caring for others, doctors who are, coming in after hours or coming in on off days, and nurses and respiratory therapists, again, going above and beyond. I go out there most weekends. I haven't always done that, but the past many weeks I have, just to, again, to encourage people. But the pandemic is not over. But I do want to say I look at this every day. I can tell you any number you want to know every day. We're always over 100%. The ER, it seems like. But those numbers are starting to mitigate a little bit. We have, in the past 2 weeks, I think, seen it finally start to level off. I got a little ahead of myself last Monday and Tuesday. Coming off of Labor Day, we had with several deaths over the Labor Day weekend, unfortunately. And so I was out here on Labor Day, or out there, and the numbers were beginning to level off a little bit, where we were in the mid to upper 60s of COVID patients, and to give you some sense, that was nearly half of our patients. And then I began to see that number level off, and then all of a sudden it peaked again. We hit our highest peak. August, you might have seen numbers in the newspaper or other places that we posted, but August, we had the highest number of COVID patients since this began. That number previously had been in January. We had 190 COVID patients admitted to the hospital in the month of January. We had 218 in August. We had, as you probably have heard, the highest number of deaths. It was the highest mortality month in the history of that hospital, 40 years that Fairview Park's been there. Most of those were COVID, not all. Obviously, we're still seeing other patients, still delivering babies, still doing emergency surgery. We're not doing elective surgeries, as I said. But of those that lost their lives, 38 of them to COVID. And those are people, those are individual lives. And people say, well, they're vaccinated or unvaccinated. Yes, the majority are unvaccinated. And those that passed that were vaccinated, most of them, all of them, had some comorbidities associated. And they were trying to do the right thing too. But regardless, vaccinated, unvaccinated, those are people. Those are lives. Those are somebody's mother or brother, or sister, or husband. I have a nurse who lost both her mother and father in the last 5 weeks to COVID. This is real. This is serious. And again, people say I'm the vaccine evangelist. I am not for big government. I'm not for mandates and everything else. But I do think that what happened yesterday was the right thing to say. Healthcare workers have to get this vaccination. And I promise you, if we would come together and to get vaccinated, our community is still not at 40%. And my own hospital is not, we're creeping up towards 70% vaccination, and that's not enough. And again, these are real people, real lives, real deaths. People that look like you and me are dying. People that are younger than ever before we have passed away. But I do see it beginning to creep down. We actually got below 50 patients with COVID yesterday. We're back up a little bit over 50, but again, that's a sign that it's beginning to wane. But if anybody has any doubt at all about whether the vaccine works, forget about what you read on social media, unless it's from a scientific source. And people go, well, how do you know? Well, ask somebody who's a scientist. If I'm not sure about something, I start with Don Nelson. But it should not surprise you that nearly 100% of our medical staff is vaccinated. And that's true across the nation. Doctors are getting vaccinated. Doctors having their children vaccinated. And they know this science better than anybody. So, but I will tell you again, the employees are doing a marvelous job. The doctors are. But this community has embraced and supported our employees. And I've seen that. The reason we've lived here for almost 14 years is because this is a community that supports one another, encourages one another. The only thing I wish we do right now is get vaccinated. But I do thank this community for the way that they have supported and encouraged our employees who are on the front lines. Nearly 80% of my employees in the last 2 months have worked extra shift, have worked overtime, have gone above and beyond to support each other and to support this community.
It's nothing personal. It's just business.
Hello?
That's how some people do things.
Right away.
To us, everything we do is personal. Because anyone can answer the call. It's who shows up that matters most. That's the quality of your independent agent and the company that stands behind them.
Ask Curry Maffett Insurance in Dublin if auto owners make sense for you.